Management Strategies by Todd Sibulus. Time management is not working as fast as you can, or multitasking, or being perfect, but time management is setting goals and priorities, organization, and avoiding pitfalls. The objectives of this presentation are, first, to become familiar with the main ideas of time management, second, see examples of each, and third, to get practical steps towards implementing them. The course outcomes related to this topic are 1. To discuss current issues affecting the American healthcare systems, 2. Evaluate leadership theories and concepts to improve staff satisfaction and to promote the delivery of quality and safe patient care, and 3. Describe methods of quality improvement for healthcare systems and outline a quality improvement plan within a healthcare environment. Implications for nurse leadership, quality, and safety in healthcare. Leadership. Good leaders know how to exhibit as well as teach time management skills to the employees they manage. Quality. Proper time management frees up nurse leaders to focus on the important tasks of patient care and care coordination. And safety. Outside of emergency situations, careful planning of how to allocate available time leads to more quality time in the moment with patients. Goal and priority setting. From our text, the first steps in time management are goal setting and developing a plan to reach those goals. Differentiate short and long-term goals. Nurse leaders dictate both for the organization for their employees' daily schedules. For example, each RN to visit 5 patients in a day is a short-term goal, and new hires will be proficient in a certain skill set after 1 year of training is a long-term goal. Setting priorities is the process of deciding when to address a certain task, issue, or problem. This plays an important safety role as leaders routinely decide which patient should be seen first. Remember Maslow's hierarchy of needs to be sure to address the most pressing issues first. Organization. Good nurse leaders must be organized as a prerequisite for handling their workload in a fast-changing environment. Being organized allows for quick access to information that may serve in an emergent situation, but also to keep the day running smoothly and minimize time and momentum lost to searching for one piece of information that has been misplaced. Example, before calling the doctor for orders, is all the necessary information organized for easy retrieval, date of birth, allergies, etc. As a nurse lead manager, are the requested days off available before the schedule is made for the next week? Try using electronic format as much as possible and labeling folders for easy identification. Electronic formats are easier to search by keyword and are easily backed up for safekeeping. Avoiding pitfalls. Our textbook identifies several time wasters, including doing too much, interruptions, and perfectionism. Doing too much. No matter the leader, no one person can do it all. Effective delegation is the key to effectively using your employees' talents to get a multitude more done than working alone. Interruptions. These are part of the job, but the effective nurse leader can quickly assess whether someone who asks something of them must be dealt with now or can safely wait until later. And perfectionism. Realize that the closest any imperfect person can come to perfect is 99.99% of the way there. The difference between good enough and world class is a non-trivial amount of time. A nurse leader must know if a task is worth extra time and effort, or if simply completing it to a satisfactory level is okay. The Nurse Organization Meeting. The meeting I attended was an interdisciplinary team meeting at the Visiting Nurse Association where I work. My geographically zoned team included the team leader, assorted upper management, as well as the nurses, therapists, and aides assigned to the patients within the team's area. The main leader was my team leader, Jody, noted for her no-nonsense approach and desire to get through as much as we could in the hour allotted to us. The behavior Jody used appeared to be useful in keeping the group on task and moving forward in a timely fashion. First, she made sure the meeting started promptly at 8:30, allowing us time to get our day organized once the meeting was over an hour later. Next, she moved methodically through the patient list, encouraging questions but reading the room quickly and moving on if there were no concerns. She showed a depth of knowledge about the patients and the procedures available to help individual clinicians around areas through which they were not able to move forward. And I wouldn't have changed any of her behaviors, as they appeared to be popular with the experienced employees and allowed me to learn even more as a novice nurse how to conduct a meeting.
In conclusion, time management is foundational to the work of nurse leaders and their employees, as well as in life in general. Being caught in the quicksand of poor time management is enough to stop progress in its tracks. This is why knowing what is important, organizing the necessary information, and moving forward methodically is a recipe for effective nurse leadership. Thank you.